Hi everyone. Today's video is about a couple of Q&As. One is about mycoplasma, the other one's about connective tissue disorders like Ehlers-Danlos syndrome. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So the first question is, I have a possible mycoplasma or other infection, candida, mold, pneumonia, low stomach acid, slight positive antinuclear antibody of 1 to 40, but my only symptom is severe hand, finger, wrist stiffness, and pain. I'm very healthy otherwise. Any thoughts? So thank you for the question. Again, as mentioned, can't give any medical advice or health advice for any specific patient over, or individual, I should say, over social media, because you're not my patient and can't give you advice, but share some thoughts around this. So when it comes to mycoplasma, I don't think I've ever had a mycoplasma case where, well, let's see here, there was hand, finger, wrist, yeah, so it's like pretty localized, right? So, hand, which include fingers, and then the wrist being next to the hand, so pretty localized. I don't think I've ever had a mycoplasma case. I mean, okay, sorry, I'll rephrase. I've never had a mycoplasma case that I'm aware of, at least, where their only symptoms were just very localized joint pain, especially in a distal extremity, like a foot or hand. I've definitely had mycoplasma cases that had notable pain issues, but those were typically, fairly diffuse pains or migrating pains affecting multiple joints. And then patients with a systemic mycoplasma issue would typically also have fatigue and brain fog at the very least, if not other symptoms, maybe other neurological symptoms, or depending on the patient, maybe some MCAS, like histamine symptoms or something like that. So if I saw a patient in my practice and their symptoms were pain or stiffness in, say, their fingers, other parts of their hand and or wrist, I would be viewing that as more of like, most likely scenario is that it's an orthopedic concern, that maybe there's some osteoarthritis or some other joint issue there, maybe a tendon issue, a ligament issue, depending on what the history was, whether any trauma to the limb, that kind of thing. Even if that patient had a mycoplasma test result that came back for some reason, and it was positive antibodies or positive, say, T cells, like an LE spot test for mycoplasma, I'd be thinking like, this is probably not what's causing these symptoms. But that being said, that's just my experience, and if anybody listening has had a different experience or has other input on this, please post in the comment section below. Be curious to hear about that, and that's kind of my general thoughts about that. So mycoplasma, mycoplasma doesn't just cause chronic infection symptoms. Standard mycoplasma pneumonia anyways would cause just a regular cold or flu type symptoms, or potentially walking pneumonia, so more respiratory tract, that type of thing. Or mycoplasma can also affect the urogenital tract as well and cause symptoms there. But in terms of like most of these more chronic cases of mycoplasma, we'd see more diffuse symptoms. So thank you again for that question. Just gonna close that tab. And the other question is, could you do a video on connective tissue disease, parasites and Bartonella, and the link to Ehlers-Danlos syndrome, or EDS, which is a type of connective tissue disease? So sure, I'm happy to do that. So I've treated quite a few patients with hypermobility, who are suffering from a hypermobility syndrome. Many of those patients have a working diagnosis of Ehlers-Danlos. There's different types of connective tissue disorders, and some of them are fairly easily diagnosed. Other ones are more of a clinical diagnosis. So in my experience, kind of the link between connective tissue disease and parasites, and I understand, just for clarification purposes, connective tissue diseases can extend beyond hypermobility disorders, but just where the question is around Ehlers-Danlos, I'll kind of limit my response to Ehlers-Danlos. But if anybody listening has questions about a different type of connective tissue disorder that's different than something on the hypermobility spectrum, post in the comment section. Happy to talk about it further. Just don't want to get into really obscure stuff here unless there's interest. So I treated many patients on the hypermobility spectrum, a number of them with, many of them, probably a majority of them actually, with Ehlers-Danlos. And the link there with parasites and Bartonella, When a person has a connective tissue issue, then anything that causes more inflammation in the body can potentially exacerbate those connective tissue issues. And that makes sense because when things are inflamed, then they're going to have a tendency to be more stretched out. And if there's already an issue with ligament laxity, then anything that's going to stretch things out further is going to potentially exacerbate those symptoms. And the reason I say that is because I've had a number of patients over the years where their connective tissue issues get a lot better, like their pain issues or their tendency to have subluxating, like popping out of place joints, is a lot less when we get their inflammation levels down without doing any work on the joints themselves. So if we want to work on the joints directly, we can use therapies like prolotherapy or platelet-rich plasma therapy, or possibly other treatments to more specifically target their connective tissues. But in a number of cases who have say been treated for mold toxicity or chronic infections like with borreliosis or maybe mycoplasma, or patients who just seem to have major detox pathway issues, they can have a notable improvement in their pain or kind of pain or musculoskeletal dysfunction when we get rid of those systemic drivers of systemic infection. With parasites, parasites would in Bartonella, of course, Bartonella fits into the systemic infection category. With parasites, unless, of course, we're talking about systemic parasite like Babesia, for example. If we're talking about more intestinal parasites, then it could certainly have the same kind of impact. I've much more experience with, say, patients with connective tissue issues, seeing systemic improvements when we work with therapies to help reduce or get rid of their SIBO, like their small intestine bacterial overgrowth, or their LIBO, their large intestine bacterial overgrowth. With parasites, as I've said in other videos, it's really hard to diagnose parasites. Clinically, I believe I've treated many patients with parasite issues, but they're just so much less common in my experience than SIBO or LIBO. I know there's other folks out there, other experts and health influencers and whatnot, who talk about how like everybody has parasites, and that may very well be true. I'm not saying it's not. It's just really, really hard to determine that objectively, I should say, with lab testing, because lab testing is notoriously inaccurate in picking up parasites. And then it's also challenging to determine that clinically, because a lot of the things that we might use more like non-pharmaceutically, like more natural products like herbs to kill off parasites, also kill off other stuff too. So some of the top anti-parasitic herbs would be things like black walnut and wormwood and pau d'arco and oregano and things like that. But those antimicrobials are also really good at killing SIBO and LIBO in a lot of cases. So if a patient goes on these anti-parasitic herbs and feels better, the conclusion that we draw there is, we can't draw a definitive conclusion that they feel better because we killed off parasites. We can draw a fairly definitive conclusion that they had some type of dysbiosis, some type of microbial imbalance in their gut, and they're feeling better, thankfully, but we don't know whether it's from parasites. So it gets a little bit tricky. But anyways, that's going down a different kind of rabbit hole. But if a patient genuinely did have parasites, intestinal parasites, that could certainly cause enough inflammation in the rest of the body by proxy through cytokine activation to exacerbate connective tissue issues like Ehlers-Danlos. So I hope that information was useful. If the person asking the question, if there's more that you're looking for than that, or more specific questions following up on that, feel free to post it in the comment section below. If anybody has any questions on this topic or anything else, again, post in the comment section below, and I will do my best to answer as soon as I can.